Issues surrounding healthcare in Canada are very emotional. Many Canadians, yes, even those in Alberta, see public health care as a fundamental right and part of our Canadian identity. This has very much stifled public debate on what should be a top priority in Alberta and Canada. Our affinity to public health care sometimes leaves us with blinders on when it comes to the problems plaguing our healthcare delivery system today. We like to champion our healthcare system as one of the best in the world. But to me, there's something inherently backwards about a system that funds sex changes but does not provide any dental coverage or support preventative screening for prostate cancer. This is not what ails our system, but it's an illustration as to how naive we can become as Canadians and Albertans when it comes to health care. We need to gather the courage to say enough is enough. Let's take a real hard, honest look at healthcare in Canada and Alberta and the fundamentals of what we value and expect. As Jim Collins wrote in his book, Good to Great, we need to face the brutal facts of reality. The brutal facts of our cherished healthcare system are, I'm just going to digress a little bit here, is that the father of public healthcare in Canada, Tommy Douglas, envisioned that user fees would still be applicable and necessary in the public healthcare system. Yet the Canada Health Act makes fees illegal. The Canada Health Act itself is a federal law in an area where our Constitution gives exclusive jurisdiction to the provinces. The budget for Alberta Health and Wellness now exceeds over 1/3 of the total provincial budget and is increasing every year and has for the last decade. On average, over 90% of the healthcare costs that we incur in our lifetime happen in our last year of living.